Good morning, class. My name is Paul Collins, and I will be presenting on the essential roles of the pancreas and liver in digestive regulation. Like I said, my name is Paul Collins. I'm a BSN RN. So the overview of digestion. I'm going to be talking about digestion and its importance, the role of the enzymes and bile, and highlighting pancreas and liver functions. So as you can see on this diagram, our digestive tract includes the esophagus, which you can't see, but this is the esophagus. It goes into the stomach. You have, which then leads into your large intestines, which is includes your ascending, transverse, and descending colon. You'll have your three components to your small intestines: your duodenum, your duodenum, and your ileum. And those empty out into your rectum and anus, and then you have your appendix and cecum, the beginning tract of your large intestine, and then up here you have your liver and your gallbladder. So the digestive process begins from the moment we consume food and involves the complex journey where food is broken down both chemically and mechanically, turning large molecules into smaller absorbable ones. The pancreas and liver play an indispensable role in this, where the pancreas contributes digestive enzymes to the body to help break down various components that we eat. And the liver produces bile, aiding in the breakdown and absorption of nutrients. Okay, continuing on, we start with the pancreas. We're going to describe the pancreas. The enzyme it produces include amylase, lipase, and protease. The role in neutralizing stomach acid with bicarb ions, and insulin and glucagon role in sugar metabolism. So as you can see here, the pancreas helps reduce bicarb. It also helps produce digestive enzymes, including the amylase, lipase, and the protease. Okay, so so the pancreas serves a dual role in digestive processes. On one hand, it excretes digestive enzymes like amylase, which helps break down carbohydrates, lipase, which helps break down fats, and protease, which helps break down proteins. It handles protein breakdown. On the other hand, it also has an endocrine function, which includes production of insulin and glucagon. Insulin helps lower your blood sugar. Glucagon helps increase your blood sugar in your body, and then it also is vital in the production, like I said already, of bicarb ions, which helps, which is essential to neutralizing stomach acid. Okay, and then continuing on with the liver, we are going to describe the liver, the bile production, its role in fat digestion, liver function, and its nutrients, metabolism, and detoxification. So the liver is a vital organ in charge of producing bile, a substance that emulsifies fats, making them more accessible for the action of digestive enzymes in the small intestines. Not just that, the liver is a metabolic powerhouse. It ensures efficient management, storage, and release of essential nutrients. It helps provide detoxification substances that could be harmful to the body. So, like I said, liver is very essential for the body. That's why when you see people that are in liver failure, either or have liver cirrhosis or hepatitis, inflammation of the liver, you start seeing significant health decline in these individuals because their liver functions are dwindling, or their liver functions are going up, which leads to decreased ability for nutrient metabolism. That's why they start having nutrient deficiencies, and also they start having what we call an increase in bilirubin, which causes a yellowish tinge of the sclera of the eyes and of the skin. Communication and coordination. The hepatic veins is a role in transporting nutrients to the liver. Hormone communication, including insulin, glucagon, and others, and how the pancreas and liver regulate blood sugar and fat metabolism. It is essential to note that the pancreas and liver do not work in isolation. They work together for the overall digestive health of the body. Their coordinated effort is facilitated through various communication channels. For instance, the hepatic portal vein transports blood filled with nutrients from the GI tract to the liver, ensuring that the nutrients metabolism and storage are closely regulated. Additionally, hormones such as insulin and glucagon are pivotal in maintaining our blood sugar levels and highlight the intrinsic endocrine communication within these organs. So as you can see here, a low blood sugar promotes the release of glucagon. The pancreas then sends the glucagon to the liver, which then increases your overall blood sugar. As your blood sugar, as your sugar increases in the body, it stimulates the pancreas to release insulin. The insulin is then sent to the liver, and then that will lower your blood sugar. So they work very close in coordination for stability of overall blood sugar of the body. Some disorders and dysregulation of the body include pancreatitis, liver cirrhosis, and these disorders can affect organ communication and coordination. When exploring disorders such as pancreatitis, which is characterized by the inflammation of the pancreas, enzyme production and secretion are compromised. The amylase, the protease, lipase aren't being utilized or manufactured appropriately. So therefore, you're going to start seeing complications throughout the body. As you're trying to eat, it's not being broken down. The absorption of the nutrients doesn't occur. So you start seeing a dwindling of health, overall health of the patients. So as pancreatitis is characterized, like I already said, by inflammation of the pancreas, enzyme production and secretion are compromised in impacting the efficient breakdown of the nutrients. Liver cirrhosis, as you can see here, this is a normal healthy liver, and this is a cirrhotic liver, very shriveled up, really bright, reddish, really dark reddish hue. That is not good for the liver. That's not a really healthy liver right there. Liver cirrhosis includes scarring. So that's what you see all here. This is the scarring of the liver. It causes an diminished ability for the liver to properly function, which causes a decreased bile production, thereby decreasing fat digestion and absorption, which interrupts other metabolic and detoxifying roles. So as you can see, the liver is very important overall. And then conclusion. The pancreas and liver are not only vital in ensuring our food is properly digested and nutrients aptly absorbed, but are pivotal in maintaining our overall metabolic homeostasis through intricate communication and coordination mechanisms. I thank you for your attention today. If you have any other questions, you can reach out to me through the university email. But if you want to, let's go over a case study real quick. So now we're going to go to the case study over here. So here's the case study. So a background, a 52-year-old Mr. Smith has been admitted to the hospital presenting with severe abdominal pain, nausea, jaundice, and unexplained weight loss for the past 2 months. Initial tests revealed elevated liver enzymes, and unusual levels of digestive enzymes in the blood. His history includes chronic alcohol consumption and a family history of type 2 diabetes. He has severe abdominal pain, nausea, jaundice, unexplained weight loss, elevated LFTs, and altered levels of digestive enzymes in the blood. Other information: his family has type 2 diabetes and alcohol consumer. Based on these presentations, Mr. Smith's background information identified potential disorders related to the liver and pancreas that might be affecting digestive health. So as you can see, Mr. Smith's alcohol consumption and symptoms of abdominal pain and nausea might suggest acute or chronic pancreatitis. Liver disease, due to his jaundice and elevated liver enzymes and history of regular alcohol use, it could be a potential cause of liver disease or even cirrhosis. Question 2. Can chronic alcohol consumption impact the pancreas and liver functions and affect their roles in digestion and metabolism? So in the pancreas, chronic alcohol consumption can lead to pancreatitis, where the pancreas becomes inflamed, affecting the production of enzyme production and release. On the liver, it causes liver disease such as cirrhosis, where liver cells are replaced by scar tissue, affecting bile production, nutrient metabolism, and detoxification processes. Question 3. Explain how Mr. Smith's symptoms like jaundice, altered enzyme levels, and abdominal pain correlate with physiological process of the pancreas and liver. Jaundicing indicates compromised liver function, where bilirubin is not effectively broken down, causing yellowing of the skin and eyes. Altered enzyme levels suggest disruptions in the functioning of the pancreas and liver, which indicates either a stressed liver or damage or a decrease in enzyme production of the pancreas. Abdominal pain can be linked to pancreatitis and liver diseases, as both can manifest pain in the abdominal region in the right upper quadrant level. And then 4, if Mr. Smith was diagnosed with a disorder affecting his pancreas, how might this affect his insulin production and overall sugar metabolism, concerning his type 2 diabetes? A disorder in pancreas can potentially impact the production of insulin glucagon, affecting blood sugar regulation. Given his family history, Mr. Smith might be predisposed to the disruptions in glucose metabolism, potentially exacerbating hyperglycemic episodes, complicating management strategies. And what are some management? The question 5 is how might we improve treatment and management for Mr. Smith with his lifestyle, dietary adjustments, and medical interventions? Lifestyle includes reduction in alcohol consumption and increased physical activity. Dietary adjustments might include a balanced, low-fat diet and sugar, and adequate in protein, fibers, and essential nutrients. Medical interventions could include liver replacement therapy, or if it's diabetes, we might implement anti-diabetic medications or insulin therapy. And then we need a regular monitoring this patient with frequent checkups to monitor liver and pancreatic function, as well as blood sugar levels, ensuring optimal management and adjustment of intervention strategies. That is my presentation for today. I thank you for your time.